Video of mine is about hepatitis A, which is a highly contagious liver infection caused by the hepatitis A virus. The virus is one of several types of hepatitis viruses that cause inflammation and affect your liver's ability to function. You are most likely to get hepatitis A from contaminated food or water or from close contact with a person or object that is infected. Mild cases of hepatitis A do not require any treatment. Most people who are infected recover completely with no permanent liver damage. Practicing good hygiene, including washing hands frequently, is one of the best ways to protect against hepatitis A. Vaccines are available for people most at risk. Well, earlier I posted a short video about hepatitis A on this channel. I hope you have already seen that video. Today I am going to talk about hepatitis A in detail. Well, now let me tell you the symptoms. Hepatitis A signs and symptoms typically do not appear until you have had the virus for a few weeks, but not everyone with hepatitis A develops them. If you do, hepatitis signs and symptoms can include fatigue, sudden nausea and vomiting, abdominal pain or discomfort, especially on the upper right side beneath your lower ribs by your liver, clay-colored bowel movements, loss of appetite, low-grade fever, dark urine, joint pain, yellowing of the skin and whites of your eyes, that is jaundice, intense itching. These symptoms may be relatively mild and go away in a few weeks. Sometimes, however, hepatitis A infection results in a severe illness that lasts several months. Make an appointment with your doctor if you have signs and symptoms of hepatitis A. Getting a hepatitis A vaccine or an injection of immunoglobulin, which is an antibody, within 2 weeks of exposure to hepatitis A may protect you from infection. You should ask your doctor or your local health department about receiving the hepatitis A vaccine if you have traveled out of country recently, particularly to those countries where hepatitis A is very common and countries with poor sanitation. Or if you have visited a restaurant where you recently ate reports a hepatitis A outbreak. Someone close to you, such as roommate or caregiver is diagnosed with hepatitis A. You recently had sexual contact with someone who has hepatitis A. So in these kind of situations, you should immediately see your doctor. Now let me tell you the causes. Hepatitis A is caused by a virus that infects liver cells and causes inflammation. The inflammation can affect how your liver works and cause other signs and symptoms of hepatitis A. The virus most commonly spreads when you eat or drink something contaminated with fecal matter, even just tiny amounts. It does not spread through sneezing or coughing. And now I'll tell you some specific ways the hepatitis A virus can spread. Eating food handled by someone with the virus who doesn't thoroughly wash his or her hands after using the toilet. Drinking contaminated water. Eating raw shellfish from water polluted with sewage. Being in close contact with a person who is infected, even if that person has no signs or symptoms. Having sex with someone who has the virus. Now I'll tell you the risk factor. You are at increased risk of hepatitis A if you travel or work in areas of the world where hepatitis A is common, or if you attend childcare or work in a childcare center, live with another person who has hepatitis A, or a man who has sexually contact with the other men, have any type of sexual contact with someone who has hepatitis A or HIV positive, are experiencing homelessness, have a clotting factor disorder such as hemophilia, use any type of illegal drugs, not just those that are injected. Now coming to the complications, unlike other types of viral hepatitis A does not cause long-term liver damage and it does not become chronic. In rare cases, hepatitis A can cause a sudden loss of liver function, especially in older adults or people with chronic liver disease. Acute liver failure requires a stay in the hospital for monitoring and treatment. Some people with acute liver failure may need a liver transplant. Now I'll tell you some preventive measures. The hepatitis A vaccine can prevent infection with the virus. The vaccine is typically given in 2 shots. The first one is followed by a booster shot 6 months later. The Center for Disease Control and Prevention recommends a hepatitis A vaccine to the people with the following criteria. All children age 1 or older children who didn't receive the childhood vaccine, anyone age 1 year or older who is experiencing homelessness, infants age 6 to 11 months traveling internationally, Family and caregivers of adoptees from countries where hepatitis A is common, people in direct contact with others who have hepatitis A, lab workers who may come in contact with hepatitis A, men who have sex with men, people who work or travel in parts of the world where hepatitis A is common, people who use any type of illicit drugs, not just injected ones, people with clotting factor disorders, people with chronic liver disease, including hepatitis B or C. Anyone wishing to obtain protection, that is immunity. If you are concerned about your risk of hepatitis A, you should ask your doctor if you should be vaccinated. And now I should tell you some safety precautions when traveling. If you are traveling to other parts of the world where hepatitis A outbreaks occur, take steps to prevent infection. These steps are: you should peel and wash all fresh fruits and vegetables yourself. Do not eat raw or undercooked meat and fish. Drink bottled water and use it when brushing your teeth. Avoid all beverages of unknown purity with or without ice. If bottled water is not available, boil tap water before drinking it. Thoroughly wash your hands often, especially after using the toilet or changing a diaper and before preparing food or eating. Now I will tell you the diagnosis of hepatitis A. Blood tests are used to look for signs of the hepatitis A virus in your body. Sample of blood is taken, usually from a vein in your arm. It is sent to the laboratory for testing. Now I'll tell you the treatment. No specific treatment exists for hepatitis A. Your body will clear the hepatitis A virus on its own. In most cases of hepatitis A, the liver heals within 6 months with no lasting damage. Hepatitis A treatment usually focuses on keeping comfortable and controlling signs and symptoms. You may need to rest. Many people with hepatitis A infection feel tired and sick and have less energy. You should manage nausea. Nausea can make it difficult to eat. Try snacking throughout the day rather than eating full meals. To get enough calories, eat more high-calorie food. For instance, drink fruit juice or milk rather than water. Drinking plenty of fluids is important to prevent dehydration if vomiting occurs. You should avoid alcohol and use medications with care. Your liver may have difficulty processing medication and alcohol. If you have hepatitis, do not drink alcohol at all. It can cause more liver damage. Talk to your doctor about all the medication you take, including over-the-counter drugs. And now I'll tell you some lifestyle and home remedies. You can take some steps to reduce the risk of passing hepatitis A to others. These are: you should avoid sexual activity. Avoid all sexual activity if you have hepatitis A. Many kinds of sexual activity can spread the infection to your partner. Condoms do not offer the adequate protection. You should wash your hands thoroughly after using the toilet and changing diapers. Scrub vigorously for at least 20 seconds and rinse well. Dry your hands with a disposable towel. Do not prepare food for others while you are actively infected. You can easily pass the infection to others in this way. Okay, so this was my video about hepatitis A. I hope you like this video. If you have any questions about hepatitis A, you can post in comment section, and on my channel there are so many videos about different illnesses. And if you are suffering from any illness for which you cannot find any video, please comment about that illness, and if I get a time, I'll try to make a video about your illness as soon as possible. Thank you so much for watching this video. See you in next video. Bye for now.